My name is Walter Mazzella. I practice in Maryland, near near Baltimore and Washington D.C., in a suburb town. I opened up my practice about 11 years ago. It was a startup practice, just me, and I was the first one in the building. I would say that there are. It seems like as I would have a patient that was when I first had the first lecture was a year and a half ago, and my mind is trying to absorb all the information, and then there's always a patient that comes in the door like the next week. So there was someone who was needing a full rehab treatment, and I was like, well, let me get through give me through the treatment plan course. I didn't tell them all this, but let's see if we can get some information, then I'll, so now I've got definitely more confidence, and as I got through the first two hands-on, I was like, okay, now I can actually give this guy a treatment plan that makes sense. Well, I've taken, this is the seventh of the core 7 that I've gone through, and I did take the implanting complete care dentistry with my, and I took my entire staff, hygienist and assistant and the front desk, and that was about a month ago, and Dr. Cranham and Larry Gazzardo, and that was an excellent course. It allowed my whole staff, my team, to hear what the message is without having to hear it from the professionals. I can only relay the message to some extent, and without having it just doesn't have the same effect. So that was a big boost. They're all on board, and we each after that course we had our own checklist of things to do to change, whether it's the schedule improvement or how to block off time and how to look for different signs of instability and all the different things we've been learning. Everyone sort of gets the big picture, which is nice.